Good evening, and thank you for joining us for Roe v. Wade 2022 and beyond. This forum is sponsored by the Alameda County Council of the League of Women Voters, encompassing the leagues of Alameda, Berkeley, Albany, Emeryville, Eden area, Fremont, Newark, Union City, Oakland, and Piedmont. On June 24th, 2022, the United States Supreme Court released its decision in Dobbs versus Jackson's Women's Health Organization, overturning the constitutional right to abortion. In response to this ruling, the president of the League of Women Voters US, Dr. Deborah Ann Turner said, quote, "Today's ruling strips women and those who may become pregnant of their bodily autonomy and will have devastating and immediate consequences across the country. While the court's opinion was expected, its harm is extreme and real. When women and those who can become pregnant can no longer make reproductive decisions for their own bodies, they are no longer equal individuals in our democracy. This harm will exacerbate society inequalities and fall disproportionately on people of color and low-income communities already facing egregious obstacles to health care," unquote. The Alameda County Council of League of Women Voters hears and respects the seriousness of Dr. Turner's warning. Tonight's panel will discuss and illustrate the aftermath of the Supreme Court decision. We're very honored to have panelists Stacy Cross and Nakia Woods share their expertise and perspectives with us. Thank you both for your willingness to help educate and inspire all of us. Stacy, would you please tell us a bit about yourself and your organization?
First, thank you so much for having me here. I'm honored to be here and happy to be part of this discussion this evening. I am Stacy Cross. I'm the president and CEO for Planned Parenthood Mermonte and Planned Parenthood Advocates Mermonte. So Advocates is our 501c4, and then all of our healthcare and policy work and education is under our 501c3, which is Planned Parenthood Mermonte. We are one of 7 affiliates in the state of California. We cover 3/4 of the counties in Nevada and half of the counties in California. We're actually the largest Planned Parenthood affiliate in the country. We serve almost over 350,000 patient visits a year. We provide reproductive health care, primary care, gender affirming care at every one of our health centers, and behavior health, and much more. And we are happy to be a part of this discussion because this is such an important issue for our patients, our communities, and frankly, our country. I've been a Planned Parenthood CEO for 21 years. I started out at Planned Parenthood Montana, and I covered the entire state of Montana. And then I was a CEO in Portland, Oregon, and covered most of Oregon and part of Washington. And then I moved to California in 2017. I'm also a mom of 5 adult children that are all very strong supporters of reproductive choice. And so I'm just happy to be here.
Thank you very much, Stacy.
Thank you.
Nakia, would you share about yourself and your organization?
I'm just like, wow, Stacy's so cool. So hi, I'm Nakia. I use they and she pronouns. I'm the director of the California Coalition for Reproductive Freedom. We're a coalition that has been around for over 30 years. And we have 40 members, over 40 membership organizations, and they include members like the Planned Parenthood Affiliates of California, the California Latinas for Reproductive Justice, Roots of Labor Birth Collective, which is in Alameda County, so some of you all may have heard of them. And obviously we have over 40 members. I can't name them all. But we really work to promote sexual and reproductive health, rights, and justice throughout the state of California. We facilitate member-driven initiatives, and that includes strategic communications, connecting on policy work, connecting and collaborating on policy work, and advocacy for folks that are of reproductive, well, not even just of reproductive age in California, but those who we're talking about genderqueer folks, women, trans men, non-binary folks, and anyone that can get pregnant, right? A little bit about me. So I've only been at the coalition at almost a year and 2 weeks, but I've been a sex educator for almost a decade. And I'm also a student midwife in January. So I do a lot of birth, and I'm a birth worker. So I do doula work as well. So I'm steeped heavy into not just the policy side of this, but also the direct support piece as well.
That's great. Well, I hope that you don't have anyone have a baby in the next hour. So
Oh,
you have to
we're
go
so
help them.
lucky. My client had a baby on Tuesday, and I was like, yay, I'm so happy. I was crossing my fingers that it wouldn't be during this.
That's great. Thank you. So the format tonight will consist of 3 questions for the panelists and then end with a charge for all the attendees to move forward in the future. We'll start our first question with Nakia. Nakia, what do you see as the impact of the Dobbs decision for your organization and locally here in California?
Yeah, so for our organization, obviously we work with a ton of other a ton of other organizations. And so what we've seen is one, really having to do a lot of education in the state of California. Many folks, you hear a decision like Roe v. Wade has been overturned, the automatic thought is that abortion is now banned everywhere. I even had to even small anecdotally, I had to sit down with my grandpa and explain to him no, in California, we still have the right to abortion, right? So a lot of education and correcting misinformation that's happening throughout the state. And really reaching out to folks that are part of vulnerable communities, folks, for example, undocumented folks, where you can't risk breaking the law because that can mean deportation, right? Or for young folks who are already afraid to seek reproductive care, that's so important. Again, hearing this decision, okay, so I have to get on birth control now, and I have to get an abortion, and I have, right, because it might not be here tomorrow. So again, correcting a lot of that misinformation and being in community with our other organizations to support them. That also means that we've been very, very busy because people look to California and say, whoa, okay, so what is California doing? How can we replicate that? And so thinking about, we are part of the Future of Abortion Council in California and doing a lot of heavy lifting on the policy end. So looking at not just abortion, but contraception. And birth control rights and access. We all know, well, not we all know, when abortion is under attack, our other rights are also under attack. The reversal of the Roe v. Wade decision also can mean the reversal of other major decisions like gay marriage, right? So we've been working really hard, and we are a small organization. So I'm the only employee currently. So sometimes we have 2 people. And so that does mean a lot of ripping and running and creating educational materials. And then for our members, right, especially those who do direct service work, seeing an influx in the folks that they're seeing. We know that people are going to be traveling to California. We know that people already have been calling the health lines that are there, and also seeking, again, a lot of information because they know that they can in California. I feel like I answered the whole question, but Stacy's going to talk for a little bit too, and then we'll go back and forth.
Yeah.
Okay, so Stacy, what is the impact of the Dobbs decision for Planned Parenthood and locally here in California?
Well, Planned Parenthood across the country, as we know, when the leak happened, we knew that everything that was protected by privacy was at risk. As Nakia just said, so marriage equality is at risk, birth control is at risk, abortion's at risk, interracial marriage is at risk. And right now, 18 states have some form of ban on abortion. We are from what we're looking at potentially 26 states having a ban. And of course, a lot is riding on the upcoming elections next Tuesday, because in wearing my pink hat, our C4 hat, we are endorsing champions for choice, people that care about women and people seeking abortions throughout our service area. And it's really important that we vote to endorse and support those candidates. We also have here in California, we have Prop 1, which is really important. And this, I get a lot of questions about this. And this is when it is our constitutional amendment. And I get a lot of questions about why we're doing this. We are doing this because abortion is protected in our state constitution, but it was protected based on privacy. Now that privacy is at risk, we are supporting Prop 1, and we really want everybody to vote yes on Prop 1, because it not only supports and puts the rights and protects the rights of abortion in our Constitution, but also birth control. Because when the leak happened, we knew that birth control was going to be at risk across the country. And we want to ensure, even though right now in our state, we have a very pro-choice, fantastic supportive governor and state legislature, that could change in the future. And we want to ensure that if that ever does change, it has to go back to a vote of the people in California to create a ban and to overturn that. So that's why that is an imperative that this passes. We prepared for the overturning of Roe because we saw that this was coming. I get a question a lot about when I knew this was going to happen. And really, November of 2016, when our previous president got put in office that morning, when we knew that was going to happen, I knew that Roe was going to get overturned. We had already had a Supreme Court justice ripped out of our hands. We knew that there was a likelihood this court would change, and they were saying it out loud. So we knew this was coming. This was one of their goals of getting our previous president in office to overturn Roe. So we prepared for that by adding additional licensed professionals, making sure that they've been trained so they can practice as far in their licensure as possible. We're adding new locations and expanding access across our service area. And we have prepared for our healthcare side to be able to see more than 250 to 500 additional patients a week seeking abortions. We've definitely seen that in our service area. We are also participated in the Future of Abortion committee here in California, which was so important in passing some very impactful laws, including protecting our providers, helping funds be available for people seeking abortion that didn't have access or didn't have the resources to be able to access care. So it's really important across the state of California that we've collectively, all these organizations have worked together in partnership, which doesn't happen all that often. You get 40 plus organizations working together, but they were laser focused on protecting women and those seeking abortions across the state of California, and making sure that people that came in, that our doors are open and we are here to provide you with compassionate care when you come into the state of California.
That really helps me understand what's happening in California, because I don't think that we know enough about it.
Mhm.
But Stacy, you mentioned 26 states that we're looking at, and earlier Nakia and I were talking about the 26 states. Are all of the legislative actions that you're aware of, are there to just end abortion completely, or are they to restrict abortion?
Well, right now, the 18 states that have banned, 13 of them, I think, have total bans. And then there's other bans, 6 weeks, 18-week bans. All those are still very fragile right now. And remember, this is not just about banning abortion or banning access to birth control. This is really about power and control. When Roe got overturned, this is about healthcare, this is about equity, and this is about economics for women. And it is so impactful to women's lives. we know right now that 1 in 3 women in the United States live in a state where they are now a second-class citizen. They do not have control over their personal autonomy. And I know we have talked, both Nakia and I have talked about birth control, and there are already states in our country, Missouri being one, because I have a daughter-in-law that lives there, Missouri being one where you cannot get an IUD. My niece just graduated from college at Columbia, went home this summer after she finished in Tennessee. She was scheduled to get an IUD. It's a long-acting reversible contraception. It's an intrauterine device that can prevent pregnancy for 3 to 10 years, depending on which one you get. And she was scheduled to get an IUD in the following week. Her doctor called her and said, you must get in today, because if the decision happens on Monday, I cannot give you an IUD. And so this is already happening around the country, limiting access to birth control, limiting access to emergency contraception, which is the morning after pill, which helps people prevent an unplanned pregnancy if, say, their condom broke. And this is really what we're seeing is forced births across the United States, and we cannot allow that to happen in California.
And we know like a 6-week ban is essentially a ban, right? Because how many, like there's so many of us who, oh, you know, it's my period and now you're 6 weeks pregnant, right? Most of us don't know that when we get pregnant at 6 weeks, again, most people don't even know that. And even thinking about, like, I really like that you named it. This is a forced birth situation. This is forcing people to have babies. This is forcing people to risk their lives, because when you are pregnant, the amount of people don't understand how dangerous pregnancy can be. And then when we're looking at the states that have total or almost total bans, those are also states that don't have healthcare providers already. They don't have adequate healthcare. And then you look at the way that they're trying to limit sexual education. So you don't know how you can get pregnant. You can't prevent your pregnancy with birth control, and then you can't get an abortion when you didn't know, right, the different ways that you could get pregnant. It's a shame, and I'm using light language right now.
Yes, you are.
I appreciate that. And that leads really into our next question, and that's for you, Stacy, is what changes in future healthcare for women overall do you see as a result for the Supreme Court decision?
Well, we've already talked about a lot. One is, certainly we're seeing limiting access to birth control. You probably heard this on the news, but the current governor of Tennessee just caught on a hot mic saying he wants to ban birth control entirely in the state of Tennessee. And so we're going to see more and more forced births. We're going to see women, when you are pregnant and you don't want to be pregnant, you are willing to do almost anything. And by banning abortion, it just makes it illegal. It doesn't make it go away. So I am very worried about women being compromised, both their health and potentially their life and their future fertility, as what happened prior to Roe. But there's also an economic issue. Besides having a forced pregnancy, this really limits your economic future. I mean, what happened when women had access to the pill, when abortion got legalized and made it safe for women over 50 years ago, is it opened the doors for women to have hope for their future, to be a part of their family, to be able to decide when and if they wanted to have children, to be able to work and to be able to do things that built their own personal economic future. And this is going to limit those things for women in our future, which is very concerning. I was recently at a talk where a woman that was a neurosurgeon got up and spoke about the impact of Roe. 53% of the people right now in medical school are women. And she predicted that in 5 years that this will be reduced by a third if this abortion ban goes out to over 26 states. So it's an economic issue. It is a healthcare issue. And healthcare, I want to point out that it's not just all the risk of pregnancy, but also with an ectopic pregnancy, this is a life or death situation for women. And we know in several states where there's total bans, like Missouri, Texas, that the Republican AG has written to healthcare organizations and will tell them at hospitals, you cannot provide an abortion for a woman unless her organs start shutting down. So a woman has to be dying essentially before they can get healthcare to save their lives. This is unbelievable in America, but what happens to women and healthcare for women impacts their families and ultimately impacts their communities.
Thank you. Nakia, your ideas on the changes in future healthcare for women overall.
Well, one, thank you for bringing up the criminalization piece of it, right? So when we're thinking of people can become criminalized for their pregnancy losses, when we're thinking, which all of us know people that have had abortions, every single one of us on this call, whether you know it or not, and all of us know someone that has had a miscarriage, whether you know it or not. And so when we're looking at some of these bans across the country, they're criminalizing pregnancy loss. You're already going through such a tough emotional time, and then to criminalize that and say, oh, you might have to pay a fee or you might have to be incarcerated. Thinking about the mental health of the folks that are being forced to be pregnant, thinking about some of the laws and the misinformation. A lot of folks that are making these laws are making them and have no idea how a uterus works, how the flow, like they have no idea how reproduction works at all. And so they make up things and they say, y'all have probably heard some of the silly things on the news. Well, you can just stop your period. You can just stop the pregnancy from happening if you just think hard enough. No, that's not how it works. Let's open up our biology textbook really quick. We think about the misinformation that is also being shared in CPCs or crisis pregnancy centers, where they're forcing people, especially in states that might have a ban that might not have a total ban, but like a 12-week ban, forcing people to listen to heartbeats, telling lies, showing gruesome pictures of abortions that are unrealistic, and really guilting people into becoming pregnant. And then we don't think about the people that are not just the folks that are first forced to have a baby, but what happens to those children when they're living with a parent that didn't have a choice but to have them, and thinking about the impacts on those folks. So we have the very real health risk, but also thinking about the mental health piece as well. And thinking about folks, I always think about folks that are not on the forefront. So thinking about minors and young folks. In 36 states, I believe it is, there's some type of minor notification. You have to tell your parents that you're pregnant. Well, what if you live in an abusive home? What if there was an assault that happened, right? And now you have to explain this to not only your provider, who's going to convince you to keep a baby that you didn't even make a choice to have, but you have to make that explanation to your parents as well. Also thinking about folks that are in abusive relationships that are, again, might be forced to have a baby, and that's another threat on their life. Their partner told them that they can't become pregnant again, right? So it's more than just what if I accidentally get pregnant? It's deeper than that. There's so many folks that we're not even listening to, that we're not even thinking about when these bans come up. And I was gonna say something. Oh, I got it. Sorry, I was late. I was at a birth for 22 hours, so sorry. The other thing, just thinking also about gender affirming care, right? In the same states where we're seeing bans on abortion, we're also seeing bans on being queer, on being a gay person, bans on being trans, on being non-binary, and again, criminalizing folks. The people that are going to be impacted and hit the hardest with these bans are going to be folks that are poor, working class. It's going to be people of color. It's going to be queer folks and gender nonconforming folks. It's not the people that have always had access to abortion, because Roe was really already on the floor. Like, that was the bare minimum. We already weren't receiving the rights that we needed. But the people that have always been able to get abortions are going to still be able to get them. The people that are friends with doctors that can write little letters for them. The people that have partners that can spend thousands of dollars to fly them out to a state like California to get the abortion that they want. Those are the people that are not going to necessarily be impacted the same way as we are.
Thank you. And I appreciate hearing about the children as well. I think that's important.
And I'll say this really quick. I remember I was at a retreat and someone had asked this question. Like, everybody talks, about being pro-life, but what happens to the child that knows that they weren't wanted? And that's it sounds harsh, but it's a reality. There's a lot of people out there that know what that feels like. And by having people birth by force, you're just creating again a generation of folks that are going to be mistreated.
Well, I'm learning a lot. I hope our attendees are too. Both of you have touched on this a little bit, but I'd like to drill down a little bit deeper. And Nakia, what other consequences do you see possible in the aftermath of the Dobbs decision?
Yeah, I mean, we obviously have the economic piece of it, right? I don't have any babies because I know how expensive it is to have a baby. So we have obviously the economic piece of it, folks that are not going to be able to be in the workforce, people that are not going to be able, that are going to have to be on government assistance, because most folks that get abortion are people that already have babies. You're gonna have when we're thinking about some of the other sometimes words are hard. But when we're thinking about some of the other impacts, right, like this is definitely rooted in privacy laws. And so, like Stacy listed before, thinking about equality for marriage, thinking about, again, birth control and contraception, interracial marriage, which, we got Clarence on the Supreme Court, so he's really for protecting protecting interracial marriage, but who knows how long he'll be here. Those are all rights that we have because of privacy. And so thinking about what laws are going to be able to be on the books is really scary. And really thinking through the fact that we already don't have adequate healthcare. We're already not being taken care of. If you have a uterus, you know what it's like to go to a doctor and have someone tell you, oh, well, we don't know what's wrong with you. It's your hormones, maybe. So we're going to see an uptake in folks that are not being treated for things that are related to their reproductive system. Yeah, I think that's what I want to say. I want to hear what Stacy says, and we can go back and forth a little bit too.
Okay. Well, Stacy, same question. You talked about this, but I hope you'll give us more about the consequences you see.
Well, one of the things that Nakia just brought up was that many of the states that have bans also don't have access to reproductive health care. So many states prior to Roe, there were already multiple hurdles in these states that women and people seeking abortions had to already jump through and get over in order to access this. But these states also don't have they haven't done Medicaid expansion, they don't have childcare. They have inadequate foster care systems with not enough funding. And then when kids turn 18, they don't have resources. We don't have early childhood education. So many of these states that have created these bans have not done anything to compensate for what this increase in birth rate that's going to happen in these states, because they're hypocrites, and we know that. And we know that, the thing that I'm at an international women's meeting today, and one of the things that we were discussing is that this is not a political issue. Even though it's political in our country, this is an issue that's healthcare, that is economic, and that is about equity, because as was already mentioned, the people coming across the borders in California right now are driving across the borders. They're also flying across the borders. But when we get 26 states with bans, it's going to really be, ultimately, it's going to be those states on both borders, both continents, both coasts, not continents, both coasts. And then there'll be a few in the middle of the country. It's going to be the entire West Coast and the East Coast down to maybe North Carolina, but everything's iffy about that. And then we have Colorado, New Mexico, Illinois, and probably Minnesota are going to be the last state standing in the center of the country. So people are going to have to drive great distances, but it's also about, where are you going to go to college? Do you want to go to college in a state that has a ban? Do you want to work in a job in a state that has a ban that doesn't count you as a full citizen? So it's going to impact communities, states, and families in a very tragic way. And it's just not having access to abortion impacts everything. And I want to talk a little bit about a patient that we saw recently. And we have had a over 400% increase just since July of patients crossing our borders to seek reproductive health care, reproductive freedom in the state of California. And so we had a patient drive to one of our sites from one of these banned states. She arrived at our clinic after having driven for 18 hours with 2 little kids in her car because she's a single mom and she's working 2 jobs. She came, she received care, and she didn't have time to rest. She needed to get back in the car and drive back to her state that no longer considers her a full citizen because she had to go to work the next day. And that is the kind of things that are happening all across the country already with just 18 states banned. And we also know that even though there was a big push to send this back to the states, we've already seen Senator Graham put forward a federal ban of 15 weeks. We know that if this election, which is vitally important, does not go our way, we could risk having a total federal ban. But what we really are hoping for is that we see at least that we get a majority in the Supreme Court while we have a president that is supportive of women's health care so that we can pass the Women's Health Protection Act. Of course, first we have to pass the Voting Rights Act because voting is everything in our country.
And even thinking about the medical providers that we do have, there is a doctor shortage, there is a nurse shortage, like that's all very real. And with these bans, especially in banned state and states that have complete bans, we now have medical professionals that are not able to learn about abortion. That when you have a person that's coming into the ER because they have an ectopic pregnancy, and now you don't have physicians that know how to deal with that as an issue. OBGYNs that don't know how to deal with that as a medical issue. It's very much limiting the education of our providers. And on the same, what is it? Like on the other end, it's also just like a mass piece of miseducation across the board. Folks think, oh, well, the only people that are like against abortion are like a certain generation of people or this demographic. But with a ban and the spread of misinformation, there's so many people that don't even understand what abortion truly is. And folks that just don't have empathy with the decision to have to decide to end a pregnancy, whether you're like, oh, if I got pregnant today, I would have an abortion, or, oh, I got pregnant and this is not the time. There's a lack of understanding from the general public, especially in banned states, especially with folks that are men that don't have uteruses, that just don't get it. Yeah.
Thank you. Well, Stacy, you had all of the League of Women Voters when you said voting is everything, because we're with you. So we really appreciate this. This is the time now where we'll move forward into the and beyond part of the panel and ask you, what do you want to tell people that it's important to do, to watch for, and act on in the future now that Roe v. Wade has been overturned? Nakia.
Well, vote. And vote. And if you're not sure who to vote for, look at organizations like Planned Parenthood's voter guides that let you know, like, these are folks that are here to protect your reproductive freedom, and these are folks that aren't. Especially people think, oh, we're in California, we're good, this is a liberal state. Most of California is actually conservative. Shout out to Alameda County and LA County and a few others that make it so that we get to be blue. So we really do need you to pay attention to those local elections as well. It's not just the big ones. The other one is to be informed. Continue to going into webinars like this, reaching out to your small grassroots organizations, getting those educational materials, inviting folks like us to speak at your event so that you know that you're getting accurate knowledge. That's not something that's fake, no fake news. And then the last piece is to really invest in your communities. And I say that for thinking about, again, like small grassroots organizations who are on the ground doing that policy work, providing real-time support for folks, looking at organizations like Access Reproductive Justice, that is our abortion fund in California. And then also, I know a lot of times people see, and I'm going to do a call out for someone that I see on the call. Shout out to Angie from Empower Alliance. A lot of time folks think that adoption is the alternative to abortion. It is not. So making sure to be informed on like what adoption is and supporting first parents who have made the decision, and hearing the voice of first parents who have made the decision to give their children up for adoption or have been forced to. And then lastly is, no, I think I'll do those three. Those are three good things I feel like and like tangible for folks to do.
Thank you very much. Stacy.
Well, many things similar on the list. Voting, very important. I am speaking at a lot of rallies right now, and I have a lot of people push back on like, do I really have to vote? But it really matters, and the local races are important. We have to go down ticket and vote. Thank you for doing a shout out for our voter guide. When I got to Planned Parenthood Mermonte, we endorsed 30 candidates. This year, I think this midterm, I think we're endorsing 128 candidates. And the reason for that is because we know that we have to go back to like school board elections, sheriff elections, city mayors. We also know that we have very red parts of the state. We cover the whole Central Valley, and that is a really, really hard area. And we have endorsed candidates in places this year like Visalia, where we tried to put a new health center there because there's a critical need for healthcare, and we were blocked by that council there. And so we're endorsing candidates that are going to be champions for women, champions for people seeking abortions, and also champions for healthcare and a healthy community. So first of all, vote, donate, as we've already talked about, for the abortion fund, reproductive access, for Nakia's organizations, grassroots organizations, also for your local clinics, but make your donations local if you want to have an impact on California. And then also, I really appreciate you talking about misinformation, because there is so much misinformation. It's right now we're bombarded in the news with all types of misinformation and confusion. There's a lot of misinformation about Prop 1 right now. Mm-hmm. So it's good that you really read, that you continue to go to seminars like this, that you keep as informed as possible. You can go to our site, which is fightback/PPMARMONTE.org. And we have all kinds of lists of things that you can get involved in, but also tell your story, because we have to destigmatize abortion, because abortion is healthcare for women. 1 in 4 women by the time they're age of 45 have had an abortion. And it is a normal part of healthcare for many, many women, but we have to destigmatize it. That was one of the most appealing things when I came to California, is that we provide care in our health centers, and we can have a person seeking depression care, or somebody having their prostate checked, somebody, a newborn baby having a newborn check, and then we can have somebody having a medication abortion, all in room after room, because it is part of basic health care, and we have to really destigmatize it and speak our truth.
I'm so happy you said that, like telling your abortion story. And it doesn't have to be something that's like super public, right? It can be sharing with your children, like, oh, when I was XYZ age, I had an abortion for this reason, and being open and honest, especially in communities and places where you feel safe. And the more folks that share their story, the easier it is for someone else to share theirs. The easier it is for someone to say, hey, I feel like I need to fight for abortion access because I had an abortion and it meant this to me. And the more real stories that we can get, so then it's not this demonizing, terrible thing. It's like you just said, it's something it's as normal as someone saying, hey, I got the flu last week.
Right. I really appreciate you saying that also, because I shared today at this meeting that but I never got to meet either one of my grandmothers. My mom's mom died at the age of 47, delivering her 10th child, and she never made it home from the hospital. She didn't have access to birth control. My father's mother, although we were always told my whole life that she died from a ruptured appendix, she, in fact, when I went to visit her sister in a nursing home, my great aunt, she had actually bled to death in her sister's arms in 1934 because her sister had performed an illegal abortion on her, because they just couldn't. It was during the Depression. They could not afford another child. It was a family decision that they made. And that is true today as it was in 1934. Women make informed decisions about their future and about whether they can afford to have another child, whether it's the right time in their life for their other children, whether it's the right time in their life for themselves, but also all the healthcare decisions that we were talking about. So it's really important that we talk about it, that we keep people informed, and go to our website and look at the different things that you can do to help support the communities that you live in.
The 1 in 4 data point is new for me, and it's quite shocking. I think that's something I'm going to keep track of and remember when I talk to people about it. And I'll do a quick commercial for the League of Women Voters. We have endorsed Proposition 1 and Proposition 31. And we also have a candidates website called votersedge.org, where we don't actually take positions on candidates, but we allow them to post their information so that you can make an informed voting decision. So I want to thank you both so much for sharing with us this evening. There are many people in our communities that want to learn more, understand better, and be prepared to take action. And your expertise has helped all of us and created better advocates for the future. Thank you too to the attendees. You're now more empowered to move forward. In closing, I'm going to quote our national leader once more. And I'll share that Dr. Turner is an OBGYN doctor as well as an attorney. She says, quote, "The League of Women Voters stands in our power with our reproductive partners and all persons who fear the dangerous consequences of this decision. We will use our anger to fight in the legislatures, in the courts, and in the streets. We call on our elected leaders at the state and federal levels to act swiftly to restore bodily autonomy to all people. Women hold the power to create a more perfect democracy. We will not stand by as constitutional rights are stripped away one by one. Women's rights are human rights, and we will continue to fight until the right to abortion is restored. Our lives depend on it." Unquote. Thank you very much for a very informative and interesting evening. Stacy, Nakia, we can't thank you enough. Good evening.
Thank you.